Hello, stroke warriors everywhere and their families. Welcome to Stroke Warrior Radio, where we catch the wave. That's warriors achieving victories every day. This is the show where stroke and brain injury survivors, care partners, and professionals come together to share real conversations, real tools, and real help for recovery beyond limits. I'm your host, Ralph Cortese, a stroke survivor advocate, and someone who knows firsthand that recovery does not follow a timeline, and it definitely doesn't end when someone tells you it should. I'm I think today's episode is going to be deeply personal for almost every survivor listening. That moment when therapy ends, the appointment stops, the structure disappears, the support fades, and suddenly you're hit with now what? Because recovery didn't stop, but the system did. And today we're going to unpack that. To help us do that, I'm joined by Dr. Melanie Brennan, a physical therapist, doctor of physical therapy, CEO and founder of EA Therapeutic Health. She's built her work around helping people continue therapy beyond the traditional means. Melanie, thank you and welcome to Stroke Warrior Radio.
Thank you so much for having me, and what a great purpose for a podcast. I think it's wonderful what you're doing.
Thank you very much. It's going very well too. So let's get a little bit into the brief history of EA and what brought you and your staff to this purpose and initiative.
Yeah, I'll try to make it brief. Sometimes it's a long story, but I'll try to make it brief. I was a physical therapist for many years, working at the Mayo Clinic in Rochester, Minnesota, where I'm still located, and worked in the neurology department in acute rehab. Um, before coming to Mayo, I worked a few years in a stroke program up in the Twin Cities, and so kind of made my way through acute rehab, the ICU, the hospital, bedside care. I made my way to outpatient therapy there at Mayo Clinic and really began to get frustrated with the system. Once I made it to outpatient, you know, even some place like Mayo Clinic, really any of the hospitals, they have to work under the current healthcare system, and they do not take cash for services. And so when insurance says no more, or if insurance says only 14 visits, that's all we can provide at a organization like the Mayo Clinic or any of really the hospitals in the country. And I got very frustrated with that because I knew people weren't ready to be on their own. I knew people needed more. Um, you know, I wanted to give them more, and I wasn't able to. And so one day somebody told me, you know what, you have a real knack for wanting to think outside the box and think long term. You should start your own gym. I would come. And I went home to my husband and I said, you know what?
Yeah,
Can I
there you
quit my
go.
job at Mayo Clinic and open my own neuro recovery gym? And yeah, it didn't take him long. And he said, I think you probably could do it. We're in a good situation. Sure. And that's where it started.
Wonderful. How long ago did you start it, you said? 15?
15 years. This was back in
God bless.
2010, 2011. Yeah, that time frame.
One of the things a word I kept hearing while you were talking was neuro. I didn't realize until many years later, there's a difference in therapies
Yeah.
between a neurophysical therapist, occupation or whatever, and a physical therapist. Could you
Mhm.
explain that a little bit for our listeners?
Yeah, absolutely. It's not that indifferent than a cardiologist or, an ENT or the specializations in medicine are something that really are essential in order to get really good at what you do. And so in physical therapy, similar to medical practice, we tend to develop specialties. The specialties range from pelvic health to, sports, orthopedic sports, to geriatrics, to pediatrics, and then neurology. So neurology is a really big specialty area. When we come out of PT school, we're able to do a little bit of everything, kind of like a doctor,
Yeah.
general practice. But we tend to find our niche. And then we, get continuing education, we get jobs in those areas, and we develop specialties. So neurology is one of the specialties. Typically, we work with all ages. And sometimes the neurology PTs get focused like adults only or kids only, but yeah, it's a specialty.
Yeah, again, I didn't realize it. And 7 years later, I found out a neurophysical therapist. And lo and behold, my recovery became remarkable because of the exercises and the tools they use.
Yeah, we do have specialized tools, and I always try to, if you're in a space where you can find a specialized outpatient therapist in neurology after stroke, you should. Because again, most outpatient physical therapists who hang a shingle have a space, they're 99.9% chance going to be orthopedic. And that's their sweet spot. They like to work on shoulders, knees, hips, backs. They're very good at their practice. But when somebody comes in with a stroke, pretty rare they're not going to say, well, I'll do my best. And that's,
Yeah,
if they're in a small town, if you're in a place where you do not have a specialty practice, they will do their best. They do have those basic foundational abilities to treat. But there's, and if you've worked with a neurologic therapist, you know that we pride ourselves in being really good at our craft.
yeah, exactly. And I think one of the things, and as you mentioned, I've interviewed people from England and the National Health Service. Oh my God, those people got 13 visits. They're done. I mean, there is no coming back. So, take us into that moment where a person is discharged and they go for multiple therapy sessions a week, maybe outpatient, inpatient, and they wind up with nothing all of a sudden. Um, Tell us about that. Um, what do you think or see really happening in those moments? For example, in my case, I had an emotional response. I was very stressed about getting out and, not being able to do it again. Physical response, mental response. How do you see that happening?
Yeah, so it is often not well received and it causes a lot of stress. And honestly, it's if you poll physical therapists, it's the worst part of our job. We really, going back to how we got into this situation, we got into this situation because back in the 70s, 80s, and into the 90s, we began allowing health insurances to determine our care. And because there's a limited resource of funding, right? And so there needed to be some parameters put on the expense. And unfortunately, the parameters aren't based around need of people getting back to previous full independence or back to their fullest function. If it was, we would stick with anyone with a stroke or spinal cord injury for 10 plus years because the improvements continue. And we know that through neuroplasticity. But unfortunately, people who are divvying out the money for health insurance, usually driven by an organization called CMS, Centers for Medicare and Medicaid Services. They had to put a parameter on it, and it's extremely arbitrary. It's difficult for us in the medical system to navigate it, but unfortunately, we have to navigate it because we can't work for free. Somebody has to pay the bill, right? Like we all have house payments and we all have kids, and this is a job for us as much as it is a passion. And so we started letting the insurance companies run what we do. And it's just been a downward slope. Over my career of 30 years as a PT, it's only gotten worse. Our payment has not increased since the late 90s.
Oh my gosh.
Yeah, yep. In fact, we're getting paid less by Medicare and in most states by Medicaid. We're getting paid less than we did in 1999. Yet our costs have tripled
Yeah,
with
yeah,
inflation,
exactly.
And so we're letting the insurance companies run things and therefore we don't want to stop. We as physical therapists know we can make meaningful impact in people's lives for years after a neurologic insult. But unfortunately, the insurance companies say 14 visits a year. And then we're forced to manage that. And it's a frankly an awful system for us to be working in. And I really try hard to have people know that that it's not us, it's the desire to have a payer pay for it. And so we have to live and work under their rules. And
Right.
they're not our desires. Yeah.
Well, and no, in my case, it wasn't my desire either. So, as a patient, um, I think, and I imagine you see this from our previous discussions. You do. There's a mental aspect to it for the patient. How do you address that with your patients?
Yeah, well, we created the model at EA to address that. I had no options in my job at Mayo Clinic or my job at Fairview Southdale before that. I had no options. I had to be the bearer of bad news. There was nobody else that would do it. And I had to say, I need to stop because I can't justify this anymore. And that was not what I wasn't saying you don't need it anymore. You don't deserve it anymore. You don't still have so much opportunity to improve. But I literally can't have that pay for this anymore. And so, how we deal with it at EA and why I created EA was I wanted to break free of those chains for both me and my patients. I wanted to break free and not have somebody else determine the care, but have you, the patients, determine your care. Now, at the end, again, somebody has to pay for it, right? And so we have a blend. We've created a blended model. The blended model is that we do take insurance, and we take Medicare, Medicaid. We take most major insurances for physical therapists. But I created a whole neurologic recovery exercise program, wellness program. And in that program, there are personal trainers, four-year degree exercise science majors, rec therapists. They're well trained. They work right alongside with us as physical therapists. And when that insurance, we still have to follow the rules. We cannot bill Medicare for forever. They say 10 to 12 visits a year. Some insurances are saying 6 visits a year. State of Minnesota says 14 visits a year. So we have to follow those rules. So we work intermittently with our customers from an insurance perspective, and then we have them continue the exact same exercises, the exact same activities in the same space with the same equipment, with the same walking devices, with the same neurostem equipment with our trainers. And then we work with people. So we'll get into that, but we are a nonprofit. So we fundraise, we have scholarships, we have a large endowment to help offset our costs. And so we try to make working with the trainers attractive, meaning it's
Right?
safe and effective, um, affordable, so everyone can afford it and nobody has to say no, and feasible and possible. So it's seamless. We want you to continue that work. We want you to continue to be able to access the equipment, continue to access the services. It's just not with a physical therapist and under insurance anymore. It's different under a different model of payment. But otherwise, you're getting great care. We're just going to continue that. I'm not going to say that doesn't still cause anxiety, because as soon as insurance isn't involved, people just get stressed. They say, well, why won't my insurance pay for it? We'll keep trying. Well, but I want my insurance to pay for it. They won't. This is why we designed this. They're going to take care of you and we're still here.
Yeah, yeah. I'm I, I'm interested in a couple words that strike us all. Um, usually discharge is based on recovery. Maybe it's not, or based on limitations for not discharging you, or it doesn't. The discharge moment isn't a successful concept. Okay, that doesn't mean you're better in most cases, and some people confuse that.
Mhm.
Um, People hear and think, this is it. Um, so let's talk about a word that's used an awful lot, plateau, or the
Mhm.
phrase that I consider slapping a provider when I hear it nowadays is this as good as it gets.
Yeah.
I mean, I see from your staff and your perspective that my own recovery could have been so much better had I met somebody. How do we, as survivors of TBI, strokes, whatever, find people like you? How do we
Yeah.
Nobody had stressed to me the importance of working once I got home, of
Yeah.
exercising once I got home. Could you explain that a little more?
Yeah, so many things there. Let me see if I can talk and remember all of them because so many important things. So number one, plateauing. So in the world of neuroplasticity, nobody ever really plateaus, but we also can't fight certain factors like age and immobility and debility and lack of activity. The human body, whether we want to know it, hear it or not, is always in a moment of deterioration, right?
Okay.
And so we have to work at that, right? So we do. We have to keep up a certain to keep that like balance of getting better and not worse, even with somebody without a stroke. We have to keep moving. We have to keep thinking. We have to keep working, right? Now you throw on a neurologic insult, and there's so many things that happen in the body, a cascade of things that happen that cause the cells to regenerate slower, that cause everything to be a little more difficult to maintain. And we know this through science. So once you have a stroke, once you have a spinal cord injury, you actually have to work harder than you did before to maintain, to get better, to get stronger. So as we age, are many of us doing enough activity to continue to get stronger? Right? Like, no, we all should be exercising. We all should be moving. We all should be eating well. We should be eating enough water, all of that. We all struggle with it as a society, but you throw on the stroke and you have to work harder. So we always have to push when we've had a neurologic injury. But neuroplasticity is possible anytime. We can improve anytime. We just might feel like it's a really slow climb versus
Yeah.
how it was before, right? But the nervous system, the human body improves based on what we put into it, right? So if we put the work in, it's gonna get better. We're gonna get stronger muscles. We're gonna get better nervous system. We're gonna get better eyesight if we work at that. Like all the things we can get better, but we do have to put the work into it. So I do agree that our profession doesn't do enough of talking about that. Our profession does fall short on that. When I talk to other people about their other PTs, we all should be doing home programs. PT is not this magic thing where 3 times a week for an hour, you can come and get better. That's just not the way it works, right? We should be better
Yeah.
at making sure people know that actually you need to do this every day. You actually need to do it. There's a crazy statistic from science, the amount of repetition it takes to make change after a stroke in a hand. It's in the thousands of repetitions. And so we know now through like our Vivistim work that we do, that like we literally have to have somebody sit here and it's not 10 times 3 reps. It's 1,000, right? It's a
Right.
thousand times. And so you got to do it at home. You got to exercise at home and you got to keep going. And the minute you stop, so will your recovery.
Yeah, I think it's a mindset to a certain extent. I mean, and I'm reading all the biographies of your therapist and everything. It's like, wow, these people actually ask questions. You know,
Yeah.
I of the patients, there's so many out there that we talked about it before. You sit on a bike and walk away, check off the little protocol list. Those are not the therapists we need. What do you suggest people look for in a therapist?
Yeah, well, we always start by having deep conversations about your goals, not my goals. And I train when we have students come through here and I have new staff coming in through, the first place I start in trying to teach them how we're different and how they will work differently here is that it's not your goals as a therapist. Like we have, some ego and we're like, oh, I really want this person to do stairs. Like I'm going to have them do stairs by the time they're done. Well, what if they don't have stairs in their home and they don't care? They don't want to do stairs, but
Yeah,
they want to get down on the floor and play with their grandkids. Did you ask them? You have to work on their goals because if every time they come, you work on the stairs, pretty soon they're going to stop showing up because I want to get on the floor with my grandkids, but they never ask me. So first of all, it's really having a therapist that listens and wants to know what your goals are, where you want to get. And don't be afraid to say, you know what, right now I'm in a wheelchair, but my goals are going to get back to work where I have to, I had a patient that worked on giant furnaces in commercial businesses, and he had to crawl through these furnaces
It's,
to work on
yeah.
things. And he needed to crawl and climb ladders. Well, we had to work on crawling. If he came and we never worked on crawling, he would stop coming. You should stop coming. So you want to, that's my biggest thing about listening to the clients and listening, making sure that each session is meaningful and functional to what you want to do.
I'm one of the things I discovered, and I hope you'll agree, is um, it's kind of a construct that if a doctor refers you to a physical therapy, you have to use that physical therapist. We're allowed to fire our physical therapist and doctors, and they're not up on these pedestals that you have to follow exactly who they recommend. It's got to be a relationship, I think. Do you
It
find the
does, and
same?
that's an important relationship. And just because, we hear it all the time, people say, "Oh, I tried physical therapy. I worked with so and so, and it just didn't work for me, and I'm not going to ever do it again." And that makes me sad because
Yes.
tell me more about that. And then they tell me, and I'm like, "Wow, I want to think every physical therapist is doing it for the right reasons and has put in the work to be at the top of their practice and is compassionate, and but they're not all. And if that's important to you, you should look for it.
Yeah, exactly. Well, and that brings a curious question to my head. Um, does, without continuing those therapies or at-home programs or whatever, do people regress physically,
Oh,
or can they?
absolutely. It's actually when I give my long story about why I do this, that's one of my biggest whys is that I got really frustrated with working in the outpatient hospital setting and feeling like I could only work with these people, once a week, once a month, or maybe they left because Mayo is a big destination center. Maybe they left and went home to Idaho and then they came back. I cannot tell you the percentage of how many people were worse. They had gained 20 pounds. I'd got them walking and they weren't walking anymore. They had broken a bone. They had a skin sore. They had cardiovascular disease now. They were eating poorly. They were divorced and their spouse left. So many bad things. And when it all came down to it, and I would ask them, why didn't you keep working? Why didn't you keep walking? Why didn't you go find a gym like I told you to? Like keep going. Because I had those conversations. I told people, you got to do this every day. Find a gym, find a friend, teach the spouse. You got to do this every day. Home programs. And I worked on that, all that stuff. And they would say, life gets in the way. It's hard. It's
Yeah.
hard. I just
Well,
needed to get dressed, get up, get dressed. I was depressed. Maybe my spouse tried, but they hurt their back. And so many things, right? And, a lot of it is depression. A lot of it is motivation. And then they also said, I just couldn't find anyone.
yeah,
I live in a small town. I live in a farm. I couldn't get transportation. Like it's so many barriers, and I get all those barriers. Um, but find an online group, right? Like there's those out there now. Find an online group, find an exercise group online. There's so many things, but it comes down to depression, motivation. But I was very frustrated, and I wanted to try to do something about that, at least here in my town, because I didn't want my town, Destination Medical Center. I had people saying this who lived locally. There was nowhere for them. And I
yeah.
wanted to change that.
Well, and it's interesting too, because I guess it was years 3 to 4.5, maybe 2.5 to 4.5. My confidence level was gone.
Mm.
My uh, isolation was there. I lived by myself. I didn't have a care partner, so I lived by myself. And I'm like that guy you talked about. I gained 80 pounds,
Mm.
uh, and it was a terrible time, very dark moments. So I think I don't know how to, or maybe you can make a suggestion, how to motivate survivors to make the choice of being a survivor versus a warrior. And that's what we talk about here. I
I love
chose to be
that.
a stroke warrior, you know.
I
Uh,
love that.
how do you, I don't know. I'm always trying to figure out how to motivate people to that kind of thinking.
Yeah, yeah. I think it starts with connection. We are social beings, and getting a connection of anybody that will help with the mindset shift, right? And so being with the right people that have that mindset, and just having that social connection will give that spark, that motivation. And the people around you, I think that's really important. But if you live alone, you live out in the country, there are a lot of resources online to help with that now anymore. But I think having that connection probably is what pulled, I don't know, but maybe that's what pulled you out. Like, you have to seek those connections, and you have to find people that
Definitely.
also have that warrior spirit, right? These services aren't available everywhere. And so sometimes it comes down to resources, right? And so how can you get resource rich? And that's not always money. Sometimes it's just,
Yeah.
relocating to a place. Maybe living out on the farm isn't it anymore. Maybe it was time to go to the city where there's more resources. So, those are like very individual, right? But
Yeah.
I agree. You gotta go to that level where I will improve, not just I'm going to stay here, because what happens here eventually goes down here and then down here.
Yeah, you get a mental and a physical regression. It's
Yeah.
terrible.
Hmm.
And I guess I was kind of lucky. I was angry for a lot of years, and I turned that anger into some action. So I guess that helped me. Research was huge for me. I did
Hmm.
all kinds of research, found support groups. I found exercise groups, all kinds of things, nutrition groups, and that was great. I think part of it is, um, and I think you've already described it, but people lose structure, support, accountability, momentum. Um, do you think people stop improving because they can't or because they don't know how?
Oh, for sure, because they don't know how, because I think everyone can improve. Again, if we have a system and we put an input against it, it will, we do, the human body wants safety, it wants survival, it wants improvement, it wants to operate the way it's supposed to. And so we have to give the right ingredients to make that grow, right? Like growing a plant, you have to give it all the ingredients, you have to give it water and sunlight. And if we're just in our home without sunlight and without social and engagement, and woe is me, and thinking I don't have the resources, I don't have the money, I can't, we will wither and die like the plants, right? But we do have to motivate, we have to have the structure. And sometimes it just takes creating one of those that you mentioned, right? Just
Yeah,
one, just to get you going. But you can continue to improve, just one, and then improve. And then think, oh, I'm going to join the local senior center, right? Okay, I'm going to join the local senior center and I'm going to go play cards. Okay, that's step number one,
yep, it
right?
is.
I'm going to
It's
go to church every
self-advocacy.
Sunday. Yeah, I haven't been to church in a year because I don't think I can get in there. Maybe I could call the church and see if somebody can meet me at my car and help me walk in. That's step number two.
Yes, self-advocacy. It's what you want.
Mhm.
You have to fight for it a little bit. Let's shift into a little bit into solutions.
Yeah.
Um, what should the next phase of recovery look like for a person just discharged from inpatient therapy?
Yeah. Yeah. So I believe that I have a graph that I use a lot. And the graph is that traditional medicine and rehab. It's you get hospitalized, you get your initial acute rehab, you get your outpatient rehab, and it's not that long, right? Like we're talking, this is 6 months or less, right? And then
Exactly.
there's this belief that's driven by insurances that everyone can do self-care. They got their pills, They got their home program, self-care. And there's a high failure rate. We know this, it's evidence-based, it's research-based. There's a high failure rate, which is a circle right back to where? The hospital,
Right.
right? Right back to the doctor's office, right? There's a circle from that short insurance paid care to self-care. And you talk to any insurer, because I talk to them a lot, and they say, nope, that's all we need. We're good. Just give them a home program. We don't need to pay for any more. And, we can debate whether they should pay for it or not. But I know that if you insert this idea of therapeutic health, so therapeutic health is a post-physical therapy rehab program. Maybe the skills of a physical therapist aren't required because we're kind of expensive. And I get it. Like you're already, like you're on a program, you're doing good, you're on your way up. Maybe the skills of a therapist aren't required. And I agree at a certain point. My doctorate probably isn't required. Just like every time you go to the doctor's office, you don't always get the doctor. Sometimes you get the nurse, right? Sometimes you just check in and they'll just do some labs. Like I get that, right? But somebody is needed to hold you accountable. Somebody is needed to help you, and somebody is needed that that has the specialized tools, right? And that's therapeutic health. And so if everyone had available to them the step down, which is a step up, it's not a step down, it's a step up, that your self-efficacy, you determine what you want to work on. We're here to help guide you. We know your home program. We know your disabilities. We know your motivation needs. We're here to help you. We're gonna be that cheerleader and that helper and that therapeutic partner. You come 3 to 5 days a week. You exercise. You work your brain. You get social. You have a little coffee afterwards. Like you do your thing, but you're moving, which is so essential. Movement is medicine. If people do that, that circle back to the hospital never happens.
Yeah.
It
Yeah.
never happens. We all should have it. We should not give in to anyone telling us that you're done and you no longer need any support with your rehab. You do. You do need help. You need, even if it's a motivator, even if you need somebody, even if it's a small group. We have a Parkinson's recovery program, and
Wonderful.
it's a group, right? It's a group activity. So Medicare likes to say diagnosis doesn't deem need. It's this terrible word that we hear all the time. So
Yes.
just because you have Parkinson's, just because you had a stroke, doesn't mean that you have to work with a physical therapist. This is true. But just you as a being who needs extra support because you had a stroke or because you have Parkinson's, why not have a therapeutic partner, a therapeutic group, a therapeutic, just to keep you active, moving, and doing the right things? Because there are skills that help you that you don't get at the local gym. And I think that
Yeah.
needs to come at a neurologic specialty center where our exercise specialists know those techniques. They know the research, they know the evidence, and they can help you.
And I think one of the things that, correct me if I'm wrong, that EA Therapeutic Health does is you help people understand. You may not necessarily go see a therapist with you for 10, 12 weeks, but you help them set up those programs and habits and structure that they can check back in with you. And this is working for me, this isn't. Is that about right? What a home
Yeah.
program?
A large majority of our patients do come 3 to 5 days a week here because
Right.
it holds them accountable. They see the gains. They have somebody that they can work with that keeps them safe and guides them a little bit. But it's always with self-efficacy. So like at that level, what do you want? What are your goals today? Like, what do we want to get strong today? This was your plan. We have a plan. But within this plan, we can work on X, Y, Z. And so they have a guidance, they have a person to hold them accountable. But can we work with people on a home program basis? Absolutely. And do we? Yes. So, especially if they get to a certain point, you don't necessarily need this level of care forever. And so if we can integrate people to the local gym, or people have enough support that they can do it at their home. They have, they're happy with their equipment, they're happy with their tools, they're happy with their motivation, they're happy with their social engagement. then we can absolutely check back in with us. And so we really meet people wherever they're at and really assess for their best success. So if somebody's like, no, I don't want to pay for this anymore, I think I can do this on my own. And we're going to try to find a way to help that financial issue because we know they're not going to be successful and we're just going to see them back after they have a fall, right? Like, so we try
Yeah,
our best to encourage people that no, you should keep coming,
yeah.
right? Once they're there, we say, yeah, you've got bands at home, you've got weights at home, you've got your treadmill at home, and you're totally safe on it now. And yeah, you go for it. You're watching your grandkids 3 times a week now, and yeah, you're doing great. That's fine, right?
Well, and I lost my train of thought. There's that stroke brain. I, I found, I think I told you yesterday, I was a contractor before, and I couldn't do the things I could before building. Um, but I started to do them anyway, and it looked really ugly. But it got better. I think
Yeah.
a lot of what I went through was, big deal. I did 10 steps without the walker today. But you know what? Tomorrow I did 15. That's a big deal. And
Goals are
people,
important. Yeah. I think
yes,
what you're talking about is goals and measurement. And so, it's so funny because even my staff and patients and clients, when you say it's assessment day, I'm like, yes, it's assessment day. Because it's the day that you get to look and see what progress you've made. All right. We're going to measure, we're going to look at your goals and we're going to see how far along you've come. Because people lose sight of that. Absolutely. Like you're saying, people lose sight of that. And they're like, oh, I still can't walk. Wait a minute, time out. You came in a wheelchair and could walk 2 steps. And now you're walking in from
exactly.
the car. And then when you leave here, you're walking into Quick Trip and you're walking into Target and like, no, but I still use a walker. Well, yeah, but you're
You're not using
walking.
a wheelchair.
No. And so setting goals and is really, thinking back to some of your previous questions. So to some of those people that don't know where to start, set some goals. Get out a journal it because we do have a hard time remembering. Put the date on there, journal where you're at, and then track that every week. Don't track it every day. Every day can get really frustrating, but track it every week. Go back and see where you were. That's a really great place to start.
I do two journals. I don't know if I
Yeah.
told you this. I do a
Oh.
gratitude journal and I do an anger journal. I don't
Mm.
want the anger interfering with the good things. So I do an
Yeah.
anger journal. I
I
look
love
back
that.
on that and some of the curse words and stuff I've put in there are amazing. But I also look back and say, holy cow, look where I've come from.
Yeah.
It's like
Yeah.
going to an AA meeting. You want the new alcoholics coming in to remind you where you came from. Yeah.
Some of my patients that make the best progress show me their journal.
Oh,
Absolutely.
very cool.
Mm-hmm. Mm-hmm. Yep.
How important is it to, if you have a care partner, involved care partners?
Oh, super important. I know we talked about this the other day. Yeah,
Yeah.
so we see two things. We see care partners that need respite, and we honor that, right? Like, this is the only time they leave the house all week because it's the only time the client leaves the house, and it's the only time they get to leave the house. And so when they drop them off at a place where they feel they're safe, which we are, like everybody's like, yeah, oh, you got them, right? It's their respite time. They might meet a friend for coffee. They might go to the grocery store alone. They're not having to worry about the care receiver being alone at home, right? So it's a respite time. So that's honored. However, what we do in therapy is so important to have carryover at home. And
It's a communication of goals and
yes,
processes, isn't it?
Yeah, so sometimes we have to grab them and say, "Nope, you're not leaving today." Or we plan ahead and say we're going to have a little care meeting. Because or hey, we're doing something new and I really want you to watch because they need to do this at home. So be as a care support whatever, sometimes people have a lot of different care support. Having everybody involved and knowing your therapy, your progress, your goals is so important because we need that carryover. And we see a disconnect when there's not that communication.
I agree. I agree totally. If give us three things that you would want every survivor that's been discharged to start doing immediately. I
I
think
think
journaling.
yeah, the journaling, setting some goals, making sure. So what I don't want to see is that regression happening with frustration and maybe lack of awareness or just an attitude that, well, I'm done with therapy, so I'm going to get worse now, right? That doesn't have to be the case. But you do have to find internal motivation to make it not the case. So if you say, my therapist gave up on me, I plateaued, I'm never going to get better, I'm never going to meet my goal of getting back to work, I'm never going to meet my goal of being able to watch my grandkids again, I'm never going to meet my goal of wood carving again, whatever that goal is that's important to you. If you say, everybody gave up on me, I'm never going to meet that goal, then you won't. So you got to set those goals. And then
Right?
I hope your therapist gave you tools. Like that's like if they discharged you, you should have had this conversation with them. And if you didn't, maybe there's still room to find a new therapist and try some more. Because honestly,
Yeah,
this whole you've plateaued, your insurance won't pay for it anymore. There's nothing more you can do is completely arbitrary. Let me tell you, there's not this magic Medicare person that calls and says, "Hi, I see you're still seeing Ralph. Well, he's done with his therapy. You need to discharge him." Uh-uh. That's not happening. It's
yeah,
literally each therapist determination. And so each therapist is going to look at you and your progress, your plateauing, where you are with a different light. So people might get discharged from Mayo outpatient, but when they come here, they typically qualify for therapy again because for a short time, not forever, but we are
yeah,
looking at it with such a different lens. That therapist at Mayo is like, check, they can get into their bed. Check, they can dress themselves. Check, they can feed themselves. Oh, looks like Medicare says I should discharge them. We are in the community. We are listening to your goals, and your goals is to be able to wood carve again. Your goals is to be able to drive again. Your goals, like these are big goals that Medicare tells the inpatient therapists that they're not reasonable and necessary. We look at it as is absolutely reasonable and necessary, right?
yeah,
So we may
exactly.
restart you. We may look at your home program in a much more engaging, interactive way. So I would say if you're not happy, maybe get a second opinion. I don't think a lot of people do that.
Yeah, and that's true. That's true. I know I've had to learn that myself and doing second opinion.
Self-advocacy. Yeah, don't
Yeah,
take no for an answer the first time.
that's right.
No,
It's your body. You're the captain of your own team.
absolutely.
If there was one belief that survivors have about recovery that you'd like to change, what would it be? And how do you and EA do that?
Yeah. Um, the role of physical activity, the importance of movement. And just because they can't move the way they used to, then it's not worth it. It's not enough. It's not worth doing. It's not um and frankly, just a lot of people come in with different opinions on exercise, right? Oh,
That's
you're a
true.
physical
Yeah.
therapist. You're just going to make me move. Well, yeah, because that's how the body maintains. And without movement, You will debilitate. And so, yeah, that's what we do. We're movement specialists. But a lot of people come in and say, well, I'm not going to ride that adaptive bike because I could ride a regular bike before. Like, well, it's steps, right? Like we have to start
Yeah.
somewhere, and you had a stroke, so we have to be really excited about this adaptive bike so we can get back to the regular bike, right? And we have things we have to work on in between. Well, I just don't even want to bother. So I just think keeping that open mind about those kind of things, because when you're in inpatient therapy or even outpatient medical therapy, it's very like, do this exercise, do this exercise, do this exercise. When you come to EA, it's much more about function and goals,
Oh, yeah.
right?
Great
And so
description.
keeping open about there's still so much more things to gain, even though your medical therapist said you plateaued because you couldn't do this, right? Well,
Yeah.
I, I mean, yeah, but there's other ways to do things, and how do we use what you do have in an adaptive way to get stronger and keep working? Or maybe there's other modalities, maybe there's new science, maybe there's vagus nerve stimulators, maybe there's e-stim that they haven't even tried. And so, yeah, just being open to that and knowing that there's always more.
Yes.
You do have to seek it.
Yeah. And that's one of the most interesting things I found starting the radio station was the alternative therapies out there are enormous. They may work for one person, but not another, but they're out there and they're so advanced now.
So
It's
advanced
amazing.
laser therapies, the frequency medicine and e-stim and radio frequencies and filtered sound is super powerful. We use it here at EA, and it can make incredible improvements. But you got to seek it. It's there. It's at specially thinking therapy groups. It's not, it's,
Yeah.
and also keep an open mind because Medicare doesn't like that stuff. And so you probably going to have to find resources to pay out of pocket or go to a nonprofit that can make it affordable. Because if I guess that's the other thing that to answer your question is that I want people to not be limited by insurance. It's pervasive in our society, pervasive. And we haven't helped it. Doctors for sure don't help it. I'm sorry, but I
No.
will throw the medical system under the bus on this one. Nope,
Yeah.
I'm not going to do that MRI because they won't pay for it. Well, should I have the MRI? Well, yeah, but they won't pay for it, so you don't need it. Well, why didn't I need it? I needed it before, but now my insurance won't pay for it, so I didn't need it. There are many of these alternative things that Medicare line item will not pay for. We have a non-covered list, and many of the services we provide are on the non-covered list, but I still provide them. You just
Yeah.
might have to pay cash, but they're good, they're new, they're innovative. It's like the latest cancer drug. It's new. We don't know 100% that it works, but are you going to turn it down? No, you're
No.
going to, and you might pay out of pocket for it. Yeah, because I want it.
Yeah.
Sound therapy is
Well,
amazing, but it's line item that it's not covered. You should still have it. Try to figure out resources to pay for it. Don't just say, well, if Medicare doesn't cover it, I'm not going to have it. Somebody tells us that every day. Somebody here tells us
yeah.
that. Well, I'm not going to work with that trainer because Medicare doesn't think I need it, so I'm not going to pay for it. Well, that is not serving the better of for the better good of your soul, of your progress, of your you got to think outside the box because insurance sucks. And I'm on the backside of it, but it's not designed to provide optimal health.
Right. And I think I there's so many areas that I've gone through. I told you though, that I found organizations that are willing to help. I used the 211 information number. It's across the United States and different states, but 211 found me social workers. They found me exercise equipment. They found me DME, all kinds of different things. It's going back to self-advocacy and fighting for yourself.
There's resources out there. Like I said, you just have to be open to the fact that if you might still need it, even if insurance doesn't pay for it. And so, what
Well,
are
and
the other
sometimes,
other ways to get it?
Yeah, and sometimes gamble's not a gamble. You know,
Yeah, it is. Yeah. It's not
it's
guaranteed.
sometimes
It's
a
not guaranteed.
treatment may work. Give it a shot.
Hmm. Yeah.
Anything you want to add for today's show?
I mean, wow, we covered so much, didn't we?
I know. I'm looking.
Yeah, it seemed like the general theme is like there's so many people out there that really are sitting there thinking, I wish I could do more. I think I can do more. I want to do more. Where do I start?
Yeah,
And so I think that's the theme that we talked about, and hopefully we gave a lot of good nuggets. But recognizing that everybody has barriers, and if you look for the barriers, they're going to stand in your way. But if you come at it with an attitude that there are resources, there are things. I just have to be a self advocate, and I have to start looking and start being open. Gains are possible. Neuroplasticity is real. But we
absolutely.
just have to find that point where our actions are creating improvement. But there's like this line where this is improvement, but we have to
Uh-huh.
start here. And so we have to take baby steps. And so set those goals and find those resources. Yeah.
Love it. I love it. Well, I hope we can do a couple more. I want to talk about another episode for use different tools available to us that you
Yeah.
use. And also, let's get into the science of neuro recovery. I mean, there is a science there that they've discovered since my stroke that has become very prevalent, and that's neuroplasticity. So
Yeah. Yeah.
I hope we
I
can
would
do
love
that.
that. Yeah, I would love that. That sounds great.
Cool. Well, Melanie, thank you for sharing your insights and passion with us today. And you are passionate about what you do. And to
I am.
everyone,
And there's
yeah,
more information. I guess I'll say chooseea.org. We have a lot of resources on there and information about our services in Rochester, Minnesota. But there are places like EA around the country. So, you know, Google it, check it out. They're around. They might be in your town.
cool, very
Yeah.
cool.
Yeah.
And to everyone listening, recovery does not end when therapy ends. If you've been told you plateaued, this may not be your limit. There may be limit of the system you were in. And now we want to leave you with something. And I'm adding this to all my interviews from now on. I'm going to give you a challenge, everyone listening. If you are a stroke or brain injury survivor, what is one thing you stopped doing that you could start again or should start again, I should say? If you're a care partner, how can you support continued recovery instead of assuming it's over for your loved one? And if you're a professional, what could you do differently to help people beyond discharge? And if you have a story, a tool, or a breakthrough, we want to hear from you. Melanie, you can contact at EA Therapeutic Health at the website
Choose
again.
chooseea.org.
Okay. Or you can go to calendly.com/Stroke Warrior Radio to schedule an interview with Stroke Warrior Radio and be a part of our movement. Melanie, thank you again for being here. I look forward to more shows with you and maybe some of your staff. To our listeners, remember, your story matters. Your recovery is worth fighting for, and you are never alone on this path. Catch the wave. You can be a warrior, achieving victories every day. Thank you.
Thank you. Bye.